Evening, Mark.
Good evening,
Evening, Stephanie.
Kapil.
How are you?
Hi, Kapil. Good, thank you.
I'm gonna pinch myself. I've got these two people on my show, so thank you for coming down today. I really appreciate it. I know you guys are busy as well, like some of my guests before as well, but you two, I think, are my guests where I felt like, can I get them both on, or will it be just Mark or Stephanie? So I really appreciate that you both turned up today.
My name's Stephanie Aiken. I'm a physio. We are trained in New Zealand. That's
Mm-hmm.
where I met Mark,
Okay.
and we've been over here since 1988.
In Sheen, or you were somewhere else before, I guess.
Started in Croydon when
Okay.
we first arrived over here,
Okay.
working in Croydon,
Okay.
and then I worked in near London Bridge,
Okay.
and then we moved to Sheen.
Okay. So since 1988, you've been a physio.
Yes,
Yes.
with a
Okay.
bit of a break
Okay.
when we had the kids, and then I sort of came back part
Okay.
time
Okay.
and have just sort of was working sort of more full time and more recently a bit more part time.
Okay. Do you specialize in any field within physiotherapy or?
Musculoskeletal injuries,
Okay.
as opposed to, but I see a few people with the odd respiratory thing as
Mm.
part of a musculoskeletal thing,
Okay.
but no, within the practice we
Mm.
see kiddies, older
Yeah.
people, everyone, weekend warriors.
Mm.
Mark's much more the
Athletic side.
elite sport people.
Okay.
So bit of everything and anything.
Mm. People who are watching this who want to become physiotherapists, the path to become where you guys have kind of gone through, has that changed past few years? Do they have to go university, or are there now courses that they can do and they can just straight probably work for NHS and then go private? How does that work?
To be honest, I
Mm.
think when we trained,
Mm.
it was so many decades ago. I
Okay.
think the training has changed. Plus, we trained in New Zealand,
Okay.
and now you have to do it's a degree course here now,
Yeah. Yeah.
and as it is in New Zealand.
Yeah.
So it's a 4-year degree course. You cannot just do an online course and then just for a couple of months
Mm.
and then set yourself up as a physio.
Oh, okay. Okay. But you can top up your education, I guess, once you've got your
We
qualification. Yeah.
Yep,
Yeah.
it's
Okay.
mandatory that we do our
Like
CPD.
us coaches as well. Yeah.
Yeah,
Okay.
yeah.
Excellent. So, Mark.
Ah, um, very similar, obviously, to Stephanie. We met at physio school, so I think I can leave that bit out. And we came over here, and I started working in a small private practice,
Yeah.
and then we set up Sheen Physiotherapy and Sports Injuries Clinic,
Okay.
and that's been going about 30 years now.
Mm.
So Steph and I are the partners
Mm.
in there. It's a musculoskeletal
Yeah.
based physiotherapy clinic in East Sheen.
Okay.
And we've got some associates there, and Stephanie and I, and
Okay.
yeah.
And you currently do, and you've worked before with elite athletes, I guess, as well.
So I had the privilege of working with the Great Britain rowing team
Oh,
for
excellent.
30 years.
Okay.
And that finished, and
Mm.
rightly so, it finished
Okay.
2019. So,
Oh, wow. Okay.
but we still see a lot of rowers that come through. We're in an area of rowers.
Of course. Yeah.
And then the normal, what I would say normal
Yeah.
clients, the orthopedic clients, the old clients, the back pain clients, the
Okay.
weekend warriors, as Steph said, and
Yeah. Yeah.
and kids with musculoskeletal injuries, orthopedic injuries.
When you get a qualification for physiotherapy, can you also work with young children and probably teenagers and adults, or is there a specific thing that you have to do extra qualification to work with the younger population?
I think you start out and then you probably end up sort of specializing.
Okay. Okay.
So if you're going to go down the route of neurological
Yeah.
pediatrics or specialist
Yeah.
peds, then and children, then you probably will gravitate more to that way anyway, and
Yeah.
do it more specialist courses.
Okay.
Just like if you want to do women's health,
Okay.
we can do bits, or I do a bit of women's health or sometimes men's health. But in terms of specializing, no, you do need to do a lot more
A lot more. Okay.
courses for that. So again, in our training, we we did neurological things, so
Yeah.
we could do basic treatment for strokes, but
Parkinson's as well.
yeah,
Yeah.
that's right. But to do really specialist care,
Yeah.
then you will have specialised as that part of physio and done
Okay.
more and more courses.
And I think in that sense, the magnificent NHS
Yeah.
has got a lot of incredible specialists
Yeah.
that have just worked in areas for a long period of time and are
Yeah.
training the next series of physios as they come through in those specialist areas, as Steph said, respiratory or neurological. And that will be pediatric as well.
Okay. I always get, some of my clients, I've coached for many years, and they'll probably ask me, oh, I've got this pain here. Who should I see? A physiotherapist, an osteopath, or a chiropractor? Who should I see? They ask me. Now, I'm not a qualified physiotherapist, but I do kind of ask them what the issues are, and I may suggest to see a physiotherapist, depending if it's a movement, musculoskeletal issues as well, or could be, I believe, if there's manipulation required, then maybe a chiropractor or an osteopath. I don't know, but when you see somebody, a person comes to you, if you think, I don't think they need us, they may need an osteo, would you recommend them to an osteo or would you work with them?
Yeah, I
Yeah.
certainly would.
Okay.
I think we have clients that come in and say, I go and see this particular practitioner, whether that's osteo or chiropractor, and we're not trained in that.
Yeah.
Okay, I might do some osteopathy kind of things and have done in my training, but if a client turns around and says, they get really good service from this person and it lasts for a long time, the resolution of their symptoms, then it's wrong for us to say, don't go and see that
Of
person.
course, yeah.
And so, on the other side of that, if a client comes to us and they say, well, I've been to this and had a whole lot of manipulation and I've been to kind of that and we did some muscle energy techniques. Well, again, it's silly if we try and treat their problem with those techniques.
Okay, yeah. Okay, I get it.
And so I think there's room for everyone. I'm loath to criticize because, as I said, we're not trained in. I'm a physio. I'm not trained in chiropractic, and I'm not fully trained in osteopathy. But we work with the musculoskeletal human body.
Things sort of overlap a little bit
This
too.
is the thing, yeah. So how the client, someone who's not an athlete, is just a normal person, and they can't decide who they want to see. What questions can they ask themselves? That what is the issue they have that they can probably make a choice who to see? Or is it quite difficult? They have to see at least one person, one specialist, and they see what they advise them, I guess.
I think it's quite hard because I think a lot of perception is that physios don't use their hands.
Yeah.
Physios just give you exercises, and I think some of the NHS that's sometimes how the NHS deal with a lot of they have such a volume of people that they assess them and they give them exercises and then catch up with them later. We're lucky enough that we actually can do a lot more hands-on work because we work for ourselves and we do hands-on treatment and we don't use machines.
I've always had that as well. Yeah, I've got hands-on treatment from physios as well,
Yeah.
from NHS and you guys, you especially. But I think since COVID, things have changed slightly, I believe. I don't know whether I'm wrong or not, but they're not using more hands-on approach to patients.
The physiotherapist, disappointingly so.
Yeah.
Because I would, maybe I'm a bit older, but, physical therapy, it's kind of written on the tin. So I'm disappointed when we have clients come to us that have been to any other therapist and not had hands-on.
Okay.
Where we think it might be appropriate.
Okay. In terms of dealing with injuries, are there any specific injuries that you find challenging to deal with where you learn from dealing with this patient? Could be a hip, could be spine, could be ankle, that you find that could be like, I need to really work with this person because it's challenging me. Whilst other injuries, you probably like, it's kind of very easy for you. I wouldn't say easy, but you just do it. And it's kind of, you've done so many times. There might be some repetition of injuries that you get from clients that you can deal with it straightforward. While others, you may take time and you may challenge you as well, especially with athletes. Would you say that you get those kind of injuries that are challenging?
Do you want me to?
Yeah.
So that, Kapil, that's a really good question. And we do get to see a lot of teenagers, secondary school kids who are very active and a lot of rowers.
Yeah.
And so we have the combination of quite significant spinal injuries, growing athletes, keen as mustard to get back out onto the water and do.
Yeah.
And they want, they're driven. And so the balance between letting them push themselves on, pulling them back, not training because of a significant injury, and yet these are growing teenagers.
Yeah.
And of course, they've got to keep fit.
Of course.
And you know, sometimes there's some parent involvement as well. And so, golly, that is a balancing act.
Okay.
And in answer to your question directly, every combination of teenager and parents and their sport and their injury is ever so slightly different.
Of course, yeah.
So therefore, we are learning all the time on that.
Do you think nowadays, because of social media and AI, that people, before they come and see you, they've already done their own research to see?
Yeah, Dr. Google.
Oh, Dr. Google, yeah. And then they, especially parents, because if their children are doing really well in sports, you want to make sure that you do help them to recover quickly and then play at that level, for example.
I think we've got to encourage it.
Yeah.
Because people are going to come in, and whether it is an AI system or some other system that they can check things out, then we need to be good enough to absorb that and redirect.
Yeah.
Or, in fact, if it's not for us, go to further investigation or go to a consultant and actually say, look, the Dr. Google or the AI stuff is... there are other places that people can look, but we've got to make sure that it is best for the client, or best for in my case, in that case that I've just said, the teenagers. We've got to get it right.
Of course, yeah. I mean, so in a way, do you think AI is like a hindrance sometimes, or is it like a blessing that it's helping you guys not only and also the patients? Would you say, or both?
I think it's good.
Okay.
And also I think if people can research their injury and come in and sort of say, well, look, I did this, hurt myself there.
Yeah.
I've looked it up. I think it's this.
Yeah.
And so we can go through and we assess them, take a history, assess them physically, and then together and we may come up with the same answer that AI did.
Yeah.
Or there might be slight tweaks on it. I think it can be really good, especially for anatomy, and giving profiling of an injury.
Yeah.
I think it can be quite useful.
Because sometimes I think AI also hallucinates, so it might not always be right. So you can also challenge it, saying, well, I don't agree with that. I guess you can say that, right? Because you got the experience. They said something's not right here with the response. But it's getting better. I started using AI 2 years ago when I was at St. Mary's. It was quite new. So when I was kind of messing around with it, some of the answers it gave me regarding physiology and stuff were not right, because I've done my degree many years ago. So I had to write to say this is not right. If somebody who had not done the research or not done a degree a few years ago, they would have not known the response is correct or not, and they would just have followed it and then written their paper or whatever by making some changes. So I think back then it was a little bit still in early stages. Things are changing now. That's why I don't always take everything AI says like 100%. There might be some errors there, I believe, sometimes, depending on what questions you ask, I guess. Yeah.
I would agree with you. And in the question that you asked us, it's coming through the client.
Absolutely. Yeah.
From the AI through the client to us.
Yeah.
So we've got to work with the client to then redirect their AI investigation, maybe. That sounds.
Okay. Do you enjoy working with athletes or non-athletes, or to you is the challenge every day? So you just carry on? Because I sometimes think if the athletes at high level, the expectations are very high for them to perform. So you might be under a little bit more pressure to make them recover quicker if you can, rather than somebody who's non-athlete. What would you say?
That's what you see.
Yeah.
You see
Look, another great question. I think this falls into probably a number of different stages, Kapil. The first and foremost is you've got to have an accurate diagnosis.
Okay, yeah.
Because if you don't have an accurate diagnosis, we can't set a pathway.
Yeah.
Once you've got an accurate diagnosis, then you can start engaging that pathway and bring in their expectations.
Yeah.
Some things you might be able to go to a highest level competition with an injury, and you might be able to get through that.
Yeah.
knowing that it probably won't do it any good, but they can get through that. And then you start picking up the pieces afterwards. And maybe a rib stress response in rowers might be a situation like that. Other things, it would be a disaster if you got the diagnosis wrong and then pushed them on to the final bits of training. And that could do irreparable damage, and that's not acceptable.
Okay. What's the most common injuries you see for the rowers, male and female?
Oh, I think across the years, I think lumbar spines
Lumbar spine.
and discogenic issues are there, and then the different aspects of the groups and the teenagers. We're getting some pars defects, which are small bony stress response in the lumbar spine, or rib stress responses. So we've got to take those and all those into account.
And that's for both genders, or
both
is it slightly
genders,
different for
slightly more. I think in general, probably more patellofemoral issues with the growing girls. But it's not to say the boys don't have patellofemoral issues, and that And to add to all of that, in that sport and my sport, they train really hard. Really hard. So
women's sport is doing really well at the moment. I mean, it's been escalated with football and cricket and everything else. So they probably need also more coaches and more therapists to work with them because of injuries. From my years of coaching and being in university, I always came across a lot of injury prevention plans that they were taught to us regarding sprinters or hurdlers or rowers. And I sometimes think, do people spend more time on injury prevention plans rather than training appropriately for the demands of the sport that the individual has? So they do have injury prevention plan, but I sometimes think it's way too much included in their plan. It could be, let's say, Olympic plan for 4 years, rather than just focusing on making the athlete stronger and faster. Do you come across that? Because sometimes you may, if you're working with elite athletes, you may have some disagreement with the coaches, probably, I guess, regarding what training they may do after you've healed them or done diagnosis. And where do you sit in with that kind of plan? Where are they training too much regarding injury prevention, or they're not enough?
The chief coaches that I've worked with are always questioning. They are with an athlete that is able-bodied, not injured. They're going to be questioning that athlete for their output, the testing protocols that they go through to see whether they're up, and whether the coach themselves needs to change that training for that particular athlete. If an athlete's been injured, then the coaches will be demanding of the medical staff to give an update of where they're up to and what potential training that can be done. I think the balance then of too much prep versus solid training, it comes out in the results as well. And so if they've done a lot of low grade, low level stuff, which might be important for some injury rehabilitation, it will then come out in the performance data, and the athlete will have to do some serious training to catch up to get that performance data. Now, it's not to say the rehab and the prep is not important, but some really basic things about how many training sessions have you done at the end of the season would be a good indicator of how your results stack up.
Because there are some athletes who are so confident within themselves, even if they're injured, they just ignore it and they want to play. You heard stories about Kobe Bryant or Michael Jordan years ago. They have a broken finger, but they don't care. They'll go out and play. They won't listen to anyone. Sometimes athletes are, I guess, have to work with coaches and you guys as well, and you have to convince them not to go and do this and cause further issues. But then if they want to go and take that, make that choice, for example, and cause further issues or not, it's up to them. But there plays a part of insurance and money as well, I guess. What happens to them if they made a choice to carry on? Will that cover the insurance? I guess that plays a part, I guess, right?
We're lucky or unlucky in rowing that we're talking about a Kobe Bryant and a Michael Jordan. We're in a different stratosphere with regards to financial recompense. Look, it might be that within basketball you can play with a broken finger. I don't know that. I'm not in basketball. But in a rowing crew, remember, you're only as good as the weakest link.
Yeah. Yeah.
And if somebody is so injured, is that a problem?
Yeah.
And is that going to make the boat go slower?
Yeah.
And do you have an adequate replacement?
Yeah.
And is this the most important race in the season? And if so, then you've got to make amends and possibly make changes. But if it's just something that's not quite so important, then you won't risk.
Yeah. Question for you, Stephanie. Many years ago, you were treating me for my scapula, and you did something called needling. What is needling, actually? People who don't know about it.
Dry needling.
Dry needling,
Right.
yes,
I've done courses in the past in traditional Chinese medicine.
Okay.
And that's using the same so dry needling is using the same techniques with acupuncture needles.
Okay.
It's called dry needling because nothing's going through the needle. You're not injecting anything.
Okay.
My interest in that started when, many years ago, when I worked with a girl who was inspirational in talking about trigger points. And so trigger points are little small areas in muscle that often that very tight, that refer pain all over the place. And so by needling those points or using direct pressure, sustained pressure, you can release it, but often it releases faster with dry needling, and you can get in sort of like deeper if it's appropriate.
Okay.
So I still dry. So that's what dry needling is. It's using very fine acupuncture needles to get into the tight bits of muscle to make them release.
The reason I ask you is not because you worked on me. It's when I went to see the qualifying for Wimbledon at Bank of England this year. There are a lot of players were basically with the coaches, and they were doing acupuncture. Maybe before or after the game, they're lying on the bed, on the grass, and then they will just have needles everywhere. It's like a complementary therapy, I guess, if they're doing acupuncture besides the other coaching. So I guess that's kind of taken up in sports now, because I never used to see that, but now it's just openly been done, and people are using that, I guess, to rest and to recover and all the stuff. So do you guys recommend people to kind of, if for athletes especially, like a complementary therapy after physiotherapy to work on that so they can get better quicker, or there's no quicker path by doing acupuncture?
I think acupuncture can be very, very useful. I think dry needling can be really useful, and you've just got to find the things and the techniques that work for you.
Okay.
It might be they're doing more traditional Chinese medicine as sort of releasing the energy flow. As part of their post game. Warm down, cool down. But I don't know.
I think I always seen it as a complementary therapy. Basically, I always seen it that way.
I don't think. I would agree.
They're not
with
mutually
you,
exclusive.
Yes. Yeah. Okay. That's
The athletes and those giving the dry needling or the acupuncture at the Wimbledon qualifiers would have been doing it for months and months,
of course,
and if not years.
Yeah.
The juniors, under 18s.
Oh, okay. All right.
So, and the qualifiers, so the junior qualifiers go through there too. So anybody that's done that, you would hopefully they would have tried it and practiced and actually thought, "Gosh, this works for me."
Okay.
All right, and other people might use ice baths, and you might not have seen those.
Yeah.
Other people would maybe use massage, but
Yeah.
working what's tried and true, or tried and tested for yourself.
Okay. Where do you see the psychological aspect of recovering compared to the physical side? Some people are more positive in terms of thinking about recovery, and do you think because they've got positive set of mind and they are doing recovery, they will get better before, or they will feel better compared to others who are always negative about recovery and they're thinking about, oh, another injury, I hope I don't get any more injuries later on? So the state of mind, does that play a part in recovery?
Look, the state of mind plays a massive part for an athlete.
Of
massive
course,
part. And
a non-athlete.
Absolutely, yeah. But you always come across people who are so positive mindset that they're like, whatever happens, I'll be okay. And it's fine. Just work on me and I'll be fine. And the others, they're like, oh no, what's going to happen next?
So that would all be if you're away with that athlete, that's all part of their preparation for their next competition
Yeah.
for their next event, for their next time, and hopefully you've worked with that person before.
Of
So
course, yeah.
if it's the right thing to
Mm.
do, build them up
Mm.
at that time, or it's the coach's job,
Mm.
or it's the sports psychologist's job. But yeah, that you got to be there so that they're as best prepared for when they go to the start line
Yeah.
as possible.
Do you think there's a lot more demands now on athletes to perform well?
I think across the board it's probably the same.
Same, okay.
But in a lot of sport,
Yeah.
the financial return is now significant.
Of course, yeah.
And I might change that question around a little bit. The pressures on the youngsters as they come through into the elite. So the elite may be a little bit easier, but working your way through. If we take a look at academies of footballers and how many of those make into the premiership, or tennis players, how many make in the top 250. Or, that's pressure.
Yeah, yeah. But in your experience, this is outside of physiotherapy.
Yeah.
How much genetics play a part for
Huge.
somebody? Yeah, I always believe in that as well. So even in sprinting, I always question myself, like someone getting a gold and someone coming seventh. That seventh person, most unlikely, will never get a gold or a silver, because the top 5 or top 4 have got certain genetics that they're born with, that they outperform everyone, no matter how hard the others work. So same thing, I guess, in rowing as well.
Yeah, that's
Yeah.
we had lightweights, and sadly they're not in the Olympics anymore. But that's a different debate. And
Yeah.
But the big guy and girl, who's got a huge VO2 max, and is strong, probably going to be towards the front of the field.
Yeah.
Versus those that are smaller.
But I guess all the elite rowers are about height of 6 foot tall, or there are some shorter as well, under 5'9", 5'8".
No, there we can get some tall ones.
Yeah,
The boys in the 8 in Paris that won gold, they're all pretty 6'4", 6'5", 6'6", and big guys.
Yeah. So that's why I was saying that if somebody wants to go at that level and they haven't got that power output of VO2 max capacity, you can't tell them, well, don't do it. They can carry on trying it, but to get to that level, they may not be able to.
It's a really tough question.
Yes,
It's
yeah.
a nasty question.
I know.
Yeah.
I know. It's, what people always ask me this. I mean, I spoke about this regarding runners. If you notice, more sprinters, top class and marathon runners, they've got skinny ankles. Now, because of running economy, I guess they can run faster. I'm not saying people with chunky ankles cannot run. They can, but at that level, to get to like top 5, it might be not possible. Even the Kenyan athletes who are high altitude, I guess, but also people in Nepal, Sherpas, they work on high altitudes, but they can't run as fast as Kenyan athletes because of their limb length from the hip to ankle, and the circumference is different. So again, genetics plays a huge part. I know it's one of those very blunt answer to give someone, but there might be one outlier who made it well, he or she, and they may say, look, they've done it, so can you. And that happens a lot of times as well.
I think, you're right. It's you need to have a certain accoutrement to get to the top level. And coming back to the rowing sport, these guys do testing all the way through from secondary school and through university. And they're always comparing themselves on the next person. And then they move up into junior worlds teams, and then under 23 worlds teams. And then they get into the senior squad, and they're still looking at what the next guy is pulling on the rowing machine, whether that's 2K or 5K. And then out on the water, who's beating who in trials. It counts.
Of course it does, it does. I brought the anatomy with me with the foot because I'm quite fascinated with the feet. I've been on many courses, and there's one guy called Gary Ward. Don't know if you've heard of him. He wrote a book called What the Foot, and I went on a couple of workshops, and he always talks about all the injuries we have from ankle and above are related to how your feet are and how you move in terms of pronation, supination, all this stuff. And how much do you guys tell people in terms of footwork? Let's say trainers people wear. Do you have to wear zero kind of heel to toe ratio trainers, or one of those Vivo barefoot trainers, or slightly heel trainers? Do you think those play a part in terms of performance and injuries?
Look, I don't know enough about elite
Yeah,
trainers.
yeah, yeah,
No, we just
yeah.
we can do basic assessments,
Yeah.
and if people come in and the way they
Mm.
move, they've got knee pain, ankle pain, hip pain, that is footwear
Yeah.
or bare feet,
Yeah.
and then what trainers they are wearing or
Yeah.
walking around in,
Mm.
where you can show them
Mm.
that actually you have knee pain when you go up and down the stairs. Actually, if we do this to your foot
Yeah.
or that to your knee, it feels better.
Mm.
So we need to adjust
Yeah.
what you're doing.
Mm.
Now, what are your old trainers like?
Yeah.
How old?
Mm.
How many years have you
Yes,
had
of
them?
course. Yeah.
So, but in terms of running
Mm.
and specialist footwear,
all the new trainers nowadays you see, they look really cool, really good. The heel to toe ratio is quite high, 8 millimeters, 11 millimeters, something. There's no heel activation going on there. Correct me if I'm wrong. When you have children, so when they were toddlers, did they use more of the heels when they're walking than toes? And as they grew older, the trainers they're wearing started deactivating the heels and the toes were more activated. Do you think that's what's happened past few decades? People have changed the way they walk because of the trainers, because they always raised heels.
Oh, gee.
Mm.
I think if you go into the middle of Africa,
Yeah, yeah,
they make some pretty good runners.
yeah, yeah,
And there's a lot of people running around in bare feet,
yeah,
as you said
yeah,
before.
yeah.
And so the mechanics
Mm.
of those
Yeah.
people
Mm.
may or may not be similar to our mechanics.
Of
And
course.
if you add in there something sort of slightly left of field,
Yeah,
hypermobility, then you might need to have a different trainer, and you might need to have an orthotic in that
yeah,
trainer
yeah.
to keep the mechanics, the biomechanics, as Stephanie said,
Mm.
the biomechanics of the ankles, then the knee, then
Yeah,
the hip,
yeah,
in a vertical chain,
yeah.
as opposed to something that's very mobile. And as soon as you load it, whichever way you're doing it, on a forefoot
Yeah.
or on a heel strike, that
Yeah.
the foot, for want of a better description, kind of collapses
Yeah,
underneath.
yeah.
And you might be born with a very
Yes,
stable scenario.
yes, yeah,
You might be born a sprinter,
yeah.
right? And therefore you're probably going to be a little bit
Mm.
accelerative off the forefoot.
Okay.
Maybe some of the distance people are now forefoot runners, but your average person is
Yeah.
a heel strike.
Mm. Head to toe, yeah.
Yeah.
Do you think a healthy foot should be able to pronate and supinate at the same time, or not one or the other? Like if you always pronates or always supinates, there's a problem there. But if you can do both, it's a healthy foot.
I think
a mobile
Yeah,
foot.
yeah. Mobile, yeah, yeah,
You
yeah,
need mobility
Yeah.
and strength.
yeah, yeah,
Um,
yeah. And also, I think in terms of, I've done free checks with Vivo Barefoot. They've got machines in London, and they just were giving 10 minutes of their time. And I realized all my injuries have always been left side, but my right foot's 4 millimeters longer than my left one. And also the instep depth is more on the left than right. And my toe on the right doesn't do 60-degree angle.
Yeah.
My left one does. So all those stuff, when I think about it, all the injuries I've had is always on this side. It's because the way I'm moving with this foot compared to my right foot.
So there's an asymmetry.
Yes.
Yeah.
Yeah.
And well picked up.
Yeah.
That's a good thing to
Yeah.
pick up, and then that becomes training to strengthen.
Yeah.
And that's the whole kinetic chain.
That's right. Yeah. Yeah.
And then training to, oh gosh, what am I doing with my left and
Yeah.
my right? Is
Yeah.
it the same?
Yeah.
And then you've got to go back to square one.
Square. Yeah, I know. That's the thing. Square
and
one.
mobilize your toe. If your toe's stiff and
Absolutely.
you're not
Yeah.
toeing off
Yeah, you're right. Yeah.
particularly well on one side because it's a stiff joint,
Yeah.
then that's going to make you run slightly awkwardly, isn't it?
Do you get people with lots of foot injuries or no?
Yeah.
Yeah, you do.
Yeah.
Okay.
Yeah.
Is it due to because of the sport or just?
I think we can look across the board with
Yeah.
that. And again, we've got to look at the age group. So the kiddies
Yeah.
coming in and growing, they're growing feet and they can't control them, and
Yeah.
they kind of go flat, don't they? And they've got their long bones are growing so quick that the muscles aren't
Yeah.
ready enough to release, so they start walking a bit
Yeah.
differently, and hopefully we can
Mm.
direct them on that. And then there's the traumatic kind of situation where somebody breaks something
Yeah.
or stress response. So then we start from the broken scenario to rehabilitation, and then you work through the age groups of trauma and then overuse or arthritic kind of changes, and or stress responses. That just the foot's just not coping with what is being demanded of.
If somebody in their 60s or 70s finds out about the asymmetry, is it too late for them to correct things at that age, or they can be corrected, I guess?
No,
Yeah.
it's
Okay.
you got to work with, if there's a lot of wear and tear, then you need something that's going to stabilize them so they don't pivot off a really arthritic joint. But so it might require some more specialist orthotics or shoe choice, but it might also, again, strengthen around the foot, strengthen the calf, strengthen the glutes, make them move their feet. So it's not doom and gloom, but it's so important that they look after their feet and keep them moving, because if they're not, and they're not comfortable in their shoes, then they're not going to walk, are they? They're not going to go up and down the stairs. They're not going to walk to the shops. So therefore their world.
And also maybe they psychologically they may think it's too late for me to change anything now, so I'll just suffer. I guess some people have that kind of thinking. There's no point making any changes. I guess it's too much for them, I guess.
I think for us, people will come to us because they have a problem.
Of course, yeah.
So they therefore they want to do something about it.
When I was on the workshops, we're talking about leg length. Some people have got shorter and longer, and they said that there's a very, very tiny percentage of people are born with leg length variances. Those who have that small percentage of variances is because of spinal compression. Is that true?
Remember, we were born very short.
Yeah.
And then we grow.
Yes, yeah.
And we grow very long.
Yeah.
And so on the leg length alone, this is my opinion. And the leg length alone, if you're 6'6" and you've got a 1% difference in the leg length of either of the long bones, tibia or femur, that equates to quite a distance. If you're only 5 foot nothing, and you've got a 1% difference in the femoral tibial length, then it's not such a big deal. Now you introduced the idea of this a spinal kind of component, and scoliosis, and through the adolescence and development can be involved, can have a leg length discrepancy involvement, but it also might just be the scoliosis kind of component that the leg lengths are adapting to, which is the chicken and egg on that sort of thing.
Okay.
But it is, and in rowing, it's quite a interesting concept.
When you're working with athletes, I mean, as a team, were you under more pressure working with the athletes or working with other people working with the athletes? Could be the SNC coach or could be the main coach. Where was that more pressure?
I was absolutely privileged to be in a system where we could talk.
Yeah. Okay.
And if you didn't talk, then you were kind of letting the athlete down.
Yeah.
And maybe it didn't work all of the time, but that's really important for the athlete.
Yeah.
And I think in our little private practice that we still like to keep that kind of ethos going, and we don't know everything.
Yeah.
There'll be coaches out there that we need to talk to, or consultants, or investigative kind of radiologists. These are all important for that athlete.
Okay. Because you said earlier your qualifications from New Zealand. You can transfer those skills in the UK or Australia or France, I guess, or do you have to do extra exams to get
in the time that we came over, it was directly transferable.
Okay.
And I think still to this day it's directly transferable.
Okay.
Don't know about France.
Yeah.
Don't know about the States.
Okay, yeah. I guess it might be different now, I guess. Could have been probably different even back then, which you did not because you came to UK, I guess. When you're working with athletes or non-athletes, sometimes I get this with clients sometimes. People want to stay with you for very long, even though they're recovering well, but they just want to come and see you. Like somebody who sees a counselor or therapist, they never let them go. They feel comfortable coming to see you. They get this kind of feeling that I'm okay today and they'll come back next week. Do you get that? Where you can tell them, you know what, it's been now a few weeks. I think you're fine now. You don't have to come and see me. Do you get those kind of clients or patients, I guess?
Yes, I think you do. But if why did you come in?
Yeah.
Because you had pain gardening. Okay, we've done this, you've done that, you've done all your exercises. Look how well you can move. You've gone back to gardening. You don't need to come in.
Yeah.
And so I think that's, they generally won't come in.
Yeah.
Sometimes I think, again, with sometimes older people or more infirm people, they might need a bit of extra mobilization, but maybe in a month or 6 weeks or 2 months time, and they do their exercises, but they just sometimes just a bit of stiffness. They just need a little bit of help to work out.
Okay.
Or work through, and just have hands-on stuff to just get them up and running and moving again. So I think there aren't too many people who come to us for purely a chat and psychological reasons.
Okay. They want to get recovered and leave, I guess.
Yeah.
When you guys get injured, who do you go and see? I mean, you can self-diagnose yourself. How does it work? I asked this to my massage therapist. I said, who do you go for your massages? Oh, we hate people touching us. I'm like, so they don't get massages. It's like
best physiotherapist in the world's my wife.
Okay, so
Yeah.
Do you see each other? Like, if you get injuries, do you just ask her or?
Yes.
Yes.
Yeah,
Okay.
absolutely.
Yeah. Okay.
There's no one whose opinion I'd trust more than my husband's.
Yeah. Do you ever discuss, let's say, because you work together and you guys have been working for so many years, you got so much experience. Is there any way where you exchange ideas where you have a patient that you think, you know what, let me ask Mark, what's going on here?
All the time.
All the time. Okay. All right. Okay.
All the time.
Yeah.
And some of our colleagues as well.
Yeah.
Just they'll come to us and we'll go to them. There, say there's other physios or other osteopaths somewhere around. Okay, just got this patient, just not 100% sure about this. Can you just have a look? So yes, or I think need pelvic floor stuff.
Yeah.
I've done the back work, I've done the neck work, done this, done that. Actually, this needs specialist.
Yeah.
Intensive pelvic health treatment. That's more than I can do. Go and see someone who's specialized.
So there are people out there who just specialize in pelvic, or they specialize only on ankle or hand. There are people out there who could do that.
Yeah,
Okay.
there are hand therapists. There are absolutely and utterly pelvic floor therapists, physios who work on men and women.
Okay. In terms,
men have just as many problems with their pelvic floor as women do.
Yeah, of course, yes, yeah. And also contact sports. They have a lot of rugby as well, I guess, and martial arts. You have a lot of injuries on the hips and the pelvic floor, I guess, as well. So you may see them as well. Do you see anybody from combat sports athletes, whether they are boxers or taekwondo or?
We do in a general population.
Okay, yeah, but not at that level yet.
Quite a few of these clubs and associations now have physios that are kind of associated with them and work with them, and that to me is a good thing because they build up a glossary of knowledge and experience. So they should go to those people.
Yeah.
If they want a different second opinion on something, well, we get really interested in the second opinion question.
Okay. All right.
Yeah.
But how do you guys keep up with continued education? I mean, what more can you learn? Can you carry on? I know there's so much out there, but are there any? Do you have to attend courses, or do you just learn online, or do you meet people who are at very top level, maybe working with, I don't know, Olympic athletes? You already done that, but somebody even above your level with more experience, do you see them, or do you go on courses? How does it work to keep you guys going?
You read, you do things online, always courses, and you can never say you know it all.
Absolutely.
There's always things you can learn, always techniques, and sometimes you also go back to the old things. You say, oh, I'd forgotten that technique. Okay, let's try that. Oh, it worked. So you go back and Mark, what would you do about this? I've tried that. I've tried this. And so, but no, you have to. You're obligated to, as part of become a chartered physio. You have to do so many hours of continued professional development.
What's the highest level of award for physiotherapists? Is it kind of chartered, and is there anything above it? If you're with the title,
no, you have to practice. You have to be a chartered physio.
Okay, I was asking about financial side. do physios probably earn more money when they work for athletes or with a team or a solo or in a private practice? Because I know strength conditioning coaches working for Premiership football teams or other professionals don't make as much money as some personal trainer in Mayfair who makes twice the money. So if somebody is also aspiring physiotherapist, but also they want to earn money so they can live in London, when they start earning probably from, I guess, some level, and then they start earning more money, would they make more for working for elite athletes, or would they are they better off having their own practice?
I
It's
think pathway, that some of the pathway
yeah,
things, we can't forget the NHS,
yeah,
and the NHS has a good pathway, and there's some very senior
yeah,
physiotherapists there, and they'll be earning a salary, and I don't actually know
yeah,
what
yeah,
that would be.
yeah,
Those in private
mm,
practices and those that run the bigger private practices
yeah,
will,
mm,
because they're bigger and they're
of
bigger
course,
financial
yeah,
entities.
yeah,
When it comes down to an individual working for an individual sports person, that's
yeah,
going to be very much up to
yeah,
their contract with those
okay,
people. And we see physios working with tennis players
mm,
at the highest
yeah,
end of
yeah,
those. I have heard that sometimes the people working through the more almost avant-garde clubs,
mm,
then like you said about the S&C people,
yeah,
the return is not
no,
high.
yeah,
And so the privilege of
mm,
working for those
yeah,
perhaps takes some of
yeah.
the return.
Because I see young aspiring SNC coaches because they're, let's say, a Chelsea supporter
Yes,
or
yes,
Man City supporters. They want to work for them, be their physio, their coach. But the return in terms of money is not that great. But it's a privilege, I guess, working for them.
it's
That's
a
how they
privilege.
see it.
That's
Because they're in their 20s. I don't know, maybe long term, they don't think, oh, if I can carry on working here, I'm not going to be earning as much as if I had my own private practice or, to go private, for example. But I guess you answered this privilege, I guess.
right. Mm,
Yeah.
mm.
Okay. I was going to ask you before I just remembered. Icing, using the ice on injuries. I've always had dispute. Sometimes I've seen on YouTube where icing actually is not great for you because let your body, your lymphatic system attack and try and heal that bruise rather than if you ice it, it kind of is slowing down the process of healing, especially elite athletes. I don't know where you stand in that because even a first aid course I've been on for 30 years, ice is always there as a rice as well. So applying ice after your injury and then heat maybe after a few days or a few weeks. What's your take on that regarding ice?
I'd still go down if you've
Yeah,
done something acutely
yeah,
and it's really hot and
mm,
inflamed
yeah,
and swollen.
yeah. Apply.
I'd
Mm,
still apply ice.
yeah,
If something's really hot, you
mm,
just don't want to put heat onto it.
yeah, yeah.
If
Or
it's
do nothing about it, I guess.
or do nothing about it, and
Mm,
also cold often is
mm,
helpful for pain.
yeah,
And if you can get the swelling down
yeah,
and help with the pain, then I think that's a valid reason
yeah.
for doing it. Um,
Yeah, I don't know. I think where I heard this, I think the icing started with NFL players in the 70s, I think, where they wanted the athletes to go back on the pitch quickly. So they use ice so they can, recover and go back maybe the following day or so. That's why they're using it without thinking about it, that what the long-term prospects are of recovering from the injury or the injury reoccurring again because they iced it too quickly. That's why I asked that question.
Mm,
So
mm.
yeah, um,
We use a lot of ice.
yeah,
Knee
mm,
arthroplasties, they get hot and angry,
mm,
and they
mm,
like the ice to
yeah,
cool it down and keep
yeah,
the inflammation
mm,
down. Post-operative
yeah,
situations,
yeah,
keep the
mm,
keep the inflammation down.
yeah,
But as Steph said, first 24, 48
yeah,
hours,
yeah.
cool it down,
Mm.
and then you've got heat, but then you've got hot cold too, haven't you? So
Yes. Yeah. Yeah.
and then are you wanting to make a vasoconstriction and then a vasodilation
Yeah.
so that you're getting almost a wash through kind of scenario of decreasing an inflammatory response or facilitating a blood supply or facilitating clearance of lymph?
Mm.
I'm not actually sure
Yeah.
really. Sometimes we
Mm.
know what's going on because
Yeah.
if you think about it, if you freeze something
Yeah.
down, the
Yeah.
body actually wants to homeostatically
Yeah.
make it better, and
Yeah.
so just doesn't allow it to be
Yeah.
cold. It sort of flushes blood through to warm it back up.
Mm. Mm.
So
Yeah.
conversely, also if someone's got a lot of muscle spasm,
Yeah.
sometimes they might try heat,
Mm.
but actually cold
Yeah.
can be a lot more comforting and a lot more spasm relieving and than the heat. So it's worth trying both. But something is just big injury, you've just done it, you're probably better off.
Is it a
icing.
time limit where you need to stop icing after maybe 5 or 10 days? Or it depends on how you're healing, I guess.
I think it probably depends on how you're healing.
Yeah.
And if you've got a sprained ankle and you're doing okay, your rehab's going well, but you've just gone for a longer walk and you come back and it's a bit sore, but uncomfy, yeah, you're probably better off, shoving a bag of peas on it again, icing it again, get the swelling down again, and you're good to go with carrying on with the rest of your rehab. It's all got to be part of, icing isn't just
of course.
the one and only thing. It's got to be
Yeah.
part
Yeah.
of a
Yeah.
treatment
Yes.
plan.
Yeah. Because I've always seen in football pitches and stuff, they straight away the ice packs come out. If someone's waiting for an ambulance or whatever, they've got a bruise, it just comes out. So I always wonder how long can they carry on doing that, even though they've got other treatments going on alongside it. And at what point do they start applying again hot and cold therapy? So I guess everyone's different, and depending on how long it takes to recover. There's one person, I forgot his name. I was searching today. He's American, completely against icing, absolutely against it. He'll never use it. And he thinks it's
A medic.
yeah, it's American. He was a medic, I think, as well, and he worked with athletes. He's completely against it. He did an interview with one of the coaches, physical therapists, and if I find that link, I'll send it to you. And he will never use it. He's just completely against it. That's why I thought, let me ask you guys, what do you think about it? I was going to ask you how, with ligaments and tendons, how do you work out what injury it is a ligament or a tendon? Because I mean, there are so many ligaments and tendons in your body as well. So, for example, if you're working with the knee or the ankle, how would you know from experience? Of course, you probably know it, but at what point would you say that I know exactly 100% it's a ligament and not a tendon?
Well, ligament joins bone to bone.
Yeah.
Right. So that aids stability.
Yeah.
A tendon attaches a muscle to a bone.
Yeah.
So you can stress a joint and see if that stresses a ligament and therefore that gives you pain.
Okay.
Or you can use a muscle contraction that therefore transmits the force down through the tendon, and that may cause pain. And then palpation, fingers, and also the mode of injury. Why are they, what's happened?
It could be both as well, I guess.
Yes. Yeah.
Okay.
Absolutely. And sometimes it's sometimes if something's been very long standing, there could be also be a little bit of both. If they've gone over on their ankle, they could have damaged their ligaments, but they also could have damaged some of the outside ligaments, but also the tendons of the muscle that turn the foot outwards as well when they've stressed it. So it could be a bit of both. So that's questioning and assessment.
Okay.
And then palpating.
And you also, I think, I've come across my clients who have referral pains as well. If it's coming on the elbow, it could be coming from the neck as well. So when the assessment, it comes in your assessment and diagnosis, I guess. So you find out. If you were not a physiotherapist, what would you have been? What other path would you have chosen?
I wanted to be a lumberjack.
Oh, wow, okay.
Or a pilot.
Oh, yeah, okay, yeah. You'll be amazing at assessing the pilot situation, of course, in the cockpit, yeah. Oh, wow, okay. Lumberjack, are there female lumberjacks?
I have no idea.
Yeah.
I just love trees.
Yeah, oh, okay. Why not?
So,
yeah. There's so many trees in Richmond Park, yeah, so.
Yes.
Yeah. What about you, Mark? Don't know.
I'm not sure. Maybe a pilot.
Oh, okay. Wow, okay.
Maybe the options to be a pilot in New Zealand are, with our 6 aircraft in the Air Force is not high. Not high numbers.
Yeah.
I'm not really sure. So I kind of found my way to physio, really.
Yeah. I read some stats somewhere that I think 48% of aviation pilots and also in the army are left-handers. It's quite a high number compared to the main, I'm a left-hander as well, compared to the main population of left-handers. Having that high number within this industry is quite high. I don't know whether it's to do with the brain, how it works, creativity or patience. I don't know.
We're the only people in our right mind.
Oh, okay. Yeah, that's a good answer. Do you think this has happened to me as well. Something in your life that has happened when you were really young that has made you take this path to become therapist. That could have been family or something personal to you that you said, you know what, this is what I'm going to go towards, and then try and work with other people and heal them.
My dad was a doctor,
Mm.
GP,
Yeah.
but I don't think he really influenced me.
Okay.
I went to university first before I came to physio.
Yeah.
I didn't like the university course
Mm.
I was doing, and I kind of just fell into physio
Yeah.
because I had friends who were doing it.
Yeah. Okay.
So there wasn't one really
Okay.
standout moment for me.
Okay. For you, Mark?
Similar pathway
Mm.
through university. Didn't like the Bachelor of Science I did, so did physio. But then there have been a number of broken bones with regards to sporting.
Yourself. Were you rowing as well?
And then I was a poor rower.
Okay.
That's compared to the people I've worked with. So
Okay. All right.
I was a
Okay.
poor rower, but enjoyed it and clearly drifted down that.
Okay. Did you row in New Zealand and also in UK?
Just at club level.
Just club level, yeah.
Mm.
Oh, okay. And that's why you probably got into also working with rowing athletes,
Yeah,
rowers, yeah.
Yeah.
Oh, okay. All right, cool. We're coming almost to an end. This is pretty amazing. I normally play a small game towards the end. So I think I did tell you guys there's some random questions that I've written down here. They're not kind of random, but I've got a list of 50. So every time a guest comes here, I choose the 10 questions. And then I ask them to choose a number between 1 and 10, including 1 and 10 as well. And then I'm going to ask that question. It can be related to your work or could be personal life, could be anything. So who wants to go first? Ladies first?
Okay.
All right, let me check this. Okay, so question from 1 to 10. Sorry, 1 to, actually, I've got 12 for you guys. 1 to 12, including 1 and 12. Pick a number.
7.
7. What is about the society that makes you angry?
General society.
Mm.
I think people need to be kinder,
Mm-hmm.
more polite,
Mm.
more thoughtful.
Okay, before responding, I guess be patient and think before you.
Patient,
Yeah. Okay.
Just people just need to be a bit nicer.
Mm. Do you think
Be a
people
bit
nowadays are more angrier? I see them on the roads everywhere. They just lose their boom, just like that.
Yeah.
It could be just smallest of things, and that's it. They've lost it.
Mm.
I don't know why, but yeah. And normally I see it's normally guys losing the temper. Normally when I don't drive, but I'm on the bus or walking, someone stops at red light for and turns to green, and they just stay there for 3 seconds, and hell breaks loose. That's it.
Mm.
So okay, so you want people to be kinder to each other, I
I
guess.
think people
Okay.
should just be a little bit
Mm.
kinder and thoughtful.
Mm. And what if someone's not kind to you? Then what do? You walk away?
Yes, and then I probably shout at the family.
Okay.
You know what happened to me? No, but I think yes, I try and be.
Okay. Okay. Mark, 1 to 12, but not 7.
9.
9. What lessons did your greatest failure teach you?
Ooh, what lessons did my greatest failure? I think if we're talking physio, and I'll stick with physio, this is a good thing.
Yeah.
First principles. Stick with the first principles. And if you think if there's a problem, there probably is a problem.
Okay. Okay. That was your motto kind of from.
Yeah.
Yeah. Okay. And nothing outside physio that has taught you something about life or could be anything.
Oh, there are all sorts of
Oh, there are all sorts of things
outside of life. Taught me things.
Okay. All right. That's fine. Another number. Done the 7 and 9. So we're not going to do all of them, just a few. Yeah. That's it.
Number 3.
3. What lesson did you learn from your lowest point, and is there anything about it that you feel grateful for?
Communication.
Okay.
lowest point,
Mm.
I didn't communicate.
Mm.
So if I'd actually just stopped, thought, put my hand up
Mm.
and said, I need a bit of help.
Yeah.
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 Rather than just, you know, being a woman, being a mum, being
Yeah.
just sort of, you know, I can deal with this.
Mm.
Nothing's wrong,
Mm.
but it is wrong, you know,
Yeah.
and I'm not happy.
Yeah.
So you jump up and down, you sit on it, and then, you know, maybe things are better for people now.
Yes.
But I think I learned now if I'm not feeling
Mm.
good, I'm not feeling
Yeah.
really happy, then I
Mm.
am much better at trying to
Mm.
say, you know, help or
Mm.
time out or can I have a hug?
Mm.
You know,
Yeah. Yeah.
that's yeah.
Do you think, especially for men don't ask for help, don't ask for hugs, they just don't talk about it? Do you think, I think men think that if I do, it's a sign of weakness.
Yeah.
And that's how I see. I worked with people as well, many clients and with young offenders, so they don't. It's like when they need help, but they won't say it. Girls will, but boys won't say it.
I hope things are changing.
Yeah. Yeah.
You know, where people,
Mm.
you know, it doesn't mean to say need to go on medication, doesn't
Yeah.
mean to say you need to take days off work,
Mm.
but actually even just saying,
Yeah.
I'm struggling a little
Mm.
bit here.
Mm.
I need a little bit of help. I think
Yeah.
that's good. And I think boys and men,
Mm.
it's becoming more
Yeah. Acceptable, and they do.
acceptable
Yeah. Yeah.
and
But
needed.
but I think communication, like you said, has to be done, I think, face to face, not on Zoom or online or text message. I don't know, maybe it's my age, but I just think talking talking it out or whatever issues you may have or asking for help has to be done in person rather than, online or on social media. I think. I don't know what you guys think or what your children think because they're younger than us. So,
I'm a great believer in walking.
yeah.
So I think
Okay.
walking side by side or
Yeah.
driving
Yeah.
side by side, it's
Yeah.
much easier to chat
Mm, mm.
side by side rather than face to face.
Yeah. Yeah. I tell you what,
So
during COVID, um, Apple Fitness on the watch gave 3 months free subscription to, I think, most people during COVID time. So they had this walking program on it. So what it does is it's a half an hour walk with celebrities. So it could be Prince William. So you basically put your headphones on, and he's talking about his family, Princess Diana, mom and dad. But he's walking with his dog. So when you are walking, you kind of feel that he's walking next to you. And there were celebrities and him. It was so good because you just feel like they're alongside you, and they're talking about their lives. And they may choose maybe one or two songs towards the end, like a track, what his mom liked or his family liked. It was really good idea they did that. I mean, I don't know if they still do it, but it was for 3 months that I kind of used it when I used to walk. And there are many celebrities, chefs, and I think that's what they were doing as well. So if those were alone, they were just walking alongside this person. They're talking about their lives. Yeah. So yeah, that's a good point. Yeah. Walking bare feet, I guess, or high heel shoes.
comfy trainers,
Comfy trainers. Yeah.
or
Yeah.
if there's some really nice grass bare
Yeah,
feet.
I'm a barefoot walk. I love walking barefoot on the grass, or on the sand if I ever go somewhere traveling. Yeah, I just love it. It's a feeling, sensation I get on the feet is amazing than just wearing shoes all the time. Your turn, Mark. So 3 is gone, 7's gone, 9's gone.
11.
Oh, wow. How would you define what winning means to you?
What winning means? As far as my profession
Mm,
goes,
mm,
I'll tell you a story
yeah,
first. I had the privilege, as I said, to attend some Olympic Games
mm,
and watch the rowers. And,
yeah,
the physios not at the start line,
yeah,
right? They're out there by themselves
yeah.
doing it. Semi-finals day,
Mm,
I used to get really, really, really nervous
okay.
because and there are 6 boat finals.
Mm,
And if you came fourth in a semi-final by the slightest,
yeah,
you still wouldn't have a go in the final.
okay,
So that was always my most nervous.
okay.
Obviously, that if you've then the greatest wins are when you've had some input
Mm,
into one of the athletes
mm,
at the final stages,
yeah,
and they get success
mm,
in that final kind of series of races, and
yeah,
then you kind of think, well, maybe just
mm,
a little bit, maybe I just
yeah,
had something to do with that, just a bit.
Okay,
It's a kind of
means
cool feeling.
more like an intrinsic reward for you because
Yeah.
yeah,
You
yeah,
can't write it up
yeah,
on a notice board,
yeah,
can you?
yeah. If athletes don't have injuries, do you still get paid?
Yeah.
Oh, that's amazing.
Yeah. That's an interesting one.
Yeah.
Yeah, we do.
Okay.
We do. And uh so my time was an honorarium
Mm.
plus,
Yeah.
and well, they're full timers now, the physiotherapists, the
Mm.
medics, the S&C people.
Mm.
So of course, yeah, it's an occupation, it's a
Yeah.
profession.
Yeah. Yeah. You mentioned earlier when you had a break when you had children regarding your work. How do you guys juggle when you have young children working full time? You took some time off, of course. But is it hard for professionals sometimes, one person taking time off while other person is just working full time until the kids grow up? Others cannot afford that. They both have to work. Things are changing nowadays. I think there's been a lot of, we have had issues regarding finances and everything else, I think, in the world everywhere. So, how did you find time to do all this and still have the motivation to carry on, go back in this field that you obviously love to do?
Yeah, I think it was tough. I mean, Mark, I had the opportunity to go to start
Yeah.
an elite sporting
Mm.
career, but I was 5 months pregnant,
Okay.
our first child, so
Mm.
I couldn't go and do the judo.
Yeah. Yeah.
So that I didn't really go
Mm.
down there. Once I had her, I was lucky enough to take quite a few months off,
Mm.
and Mark carried on that. So when Mark was working, it we haven't got family help over here,
Yeah. Yeah.
so and we just didn't really go down
Mm.
the nanny route.
Yeah.
So until the kiddies were a bit
Mm.
older,
Mm.
if Mark was away for training camps for weeks, 6 weeks at a time,
Yeah.
months at a time, um, I stayed at home.
Yeah. In a way, I actually strongly believe, I think the culture I come from as well, my mother was helping my dad, but then when you're children, then they just kind of take time out to raise a child. And I've got clients who work so hard and they rarely have time, only in the evenings with the kids. They've got nannies and they've got dog walkers and everything else. I mean, I know this happens a lot in some areas. People who are wealthy can do it. But I always, because I work the other side of the world where the young offenders and young children with no parents, I've seen that side as well. And I think children miss out a lot if one or both parents are not present sometimes, if especially both parents are always working and they only get time in summer holidays. But if they at least have father or mother in their lives when they're growing up, I think it's helpful and I'm not generalizing, but I think they're more healthy, I guess. I don't know. I could be wrong here. There's no stats out there, but I think they need at least from one person to be there. But some people juggle, some can't. So, and I think also is cultural as well for us. So, but yeah, but you've done a great job. I
We
mean,
were
I've met your
we were
children, so yeah,
lucky,
yes, yeah,
and I also was. It's been lovely
mm,
going back
mm,
to work, and I
yeah,
love what I do.
yeah,
Um, and
mm,
the reward is, I don't work with elite
yeah,
athletes,
yeah,
but the reward is seeing someone come in, no matter
yes,
what their age,
yeah,
with an injury,
mm,
and then empowering
mm,
them, doing something to them, but
mm,
empowering them to get back to doing what
yes,
they want to do
yeah,
in a
yeah,
pain-free, comfortable way, no matter
yeah.
what age they
Yeah.
are.
And they
So
leave you
that,
better than they found when you found them, I guess. So yeah.
God, I hope
Yeah,
so.
yeah,
But
yeah.
that's part of the joy. That's
Of course. Yeah,
that's where my reward
yeah,
comes from.
yeah.
And it's just as
Mm,
much for
mm,
Mark.
mm.
You want you know you want them to get better.
Yeah, yeah.
You don't want them to come in.
Mm. Of course, yeah. Would you ever retire from physiotherapy after 10, 15 years and just go traveling? I don't know, get a cruise ship or something?
Probably not a cruise ship,
Okay.
but I think a little bit more traveling would be
Traveling. Yeah. Have you traveled a lot, you guys? After you have, okay, yeah.
a little bit.
Yeah, a
Yeah,
little bit, yeah. And normally,
not
yeah,
enough.
not enough. Of course, you're working full time as well. We're coming to an end. We've got enough time anyway. I was going to ask you this question earlier, but I completely forgot. Do you think the machines or AI will take over our jobs as a coach and therapist, where they won't need human beings to work on them? Do you think in the future?
No,
No.
not in terms of physio.
Yeah,
I
because we're doing hands-on. Yeah,
passionately
yeah,
believe that
yeah,
actually AI will not replace
yeah.
these.
That's what I was always saying. That. Yeah,
And
yeah,
um, you can have all the massage
mm,
things
mm,
you like, but I
yeah.
think it's still going to be an adjunct
Okay.
to hands-on
Yeah.
thing.
Mm, mm.
treatment.
I'll
Okay.
add to that you said it before, Kapil,
Mm.
the psychological
Yeah.
component of
Yeah.
rehabilitation,
Mm.
hands-on,
Mm.
the person-to-person
Mm.
contact.
Yeah.
These things are important.
Mm.
These
Yeah.
things are important for the rehabilitation of the
Yeah.
client, patient,
Mm.
athlete.
Yeah. Is there any, I don't know, maybe nowadays there is it a kind of a communication course, how you speak to your clients, what words you use, so they don't feel like doom and gloom? Do you just learn that as from experiences, what language you use sometimes? Athletes and non-athletes, and sometimes also blunt that this is not going to work or whatever. Yeah.
Oh, I can be blunt.
Oh, yeah, yeah, yeah.
I think it comes with
Mm.
the color of the hair.
Okay. All right.
We
If you
learn,
have any, yes, yes.
we
Yeah.
fair. We learn long,
Yeah.
and we learn by making
Mm.
mistakes,
Yeah.
and we learn by saying things that
Mm.
you think, oh, that was wrong,
Yeah.
and you must pick that up. And
Mm.
if how do
Mm.
you've got to give bad news sometimes,
Yeah.
or you've got to say, I can't do this, but
Mm.
it comes
Mm.
in that ability to
Mm.
communicate. And for us, it's something that we picked up.
Mm. Has there been any clients in your life that you could help them because there was no way that they could recover from that whatever trauma injury they had? That was the end. That's it, and they had to just manage it.
Ah,
Mm.
there have been clients, colleagues, friends
Yeah.
who sustained horrific
Mm. Mm.
injuries, of which
Yeah.
they won't be the same person
Yeah.
again,
Yeah.
physically,
Mm.
musculoskeletally, spinal injuries,
Mm.
and they're forever in a chair.
Yeah.
As an
Yeah.
example,
Yeah.
it's what it is.
Mm. Mm. It's sad when athletes like, Michael Schumacher, I don't
Yeah,
know what state he's in, but yeah, he even had injury from skiing, not even from racing. So
correct.
one of those things where you think they are still keeping him alive, I guess, and they're hoping that one day he'll wake up.
Yeah,
But then there comes a time when you say, when do you make that decision that, you know what, the machine has to go off now, let this person go, safely or peacefully. I think it's the family. They have to make a decision, not somebody from outside, I guess. Yeah, that's the
yeah.
point where I sometimes question if I had someone in my life and was going through that. At what point will I say, you know what, I think I'll make that choice that they need to go now, but they'll have to live with that choice as well.
Mm.
Yeah,
Yeah.
perfect. Any questions for me? See, I've only got 12 minutes. Yeah, so
Kapil, on
yes,
that last
yeah,
point, I
yeah.
worked in a critical care
Okay.
ward in Auckland
Mm.
as part of my post training,
Yeah,
and it was invaluable in the sense of
yeah.
communication. We had some real sick people
Mm.
in there, and I was a physio. The physios just do a little bit of respiratory
Mm.
things, and there were questions that were given to the next of kin
Yeah.
that are just as
Mm.
you expressed and explained.
Yeah.
I never once saw that those consultants or those
Mm.
medics ever think lightly of asking those questions, and it always played
Mm.
heavily enough
Yeah.
on them
Mm.
to let the next of kin
Yeah.
make those decisions on a
Mm.
well-informed and a consensual kind of basis.
Yeah. Yeah.
So when it does, or if it does come
Mm.
to you, I would like to think that our system would prepare you,
Yeah.
and that you and your family have
Yeah.
had that discussion, and it is
Yes.
the right way to go forward
Yeah.
for those people.
I think people sometimes that I've come across and I've asked these questions, I've got some friends, they are Hindus, Sikhs, follow Islam or Christianity. Sometimes they use religion as like saying, we've come here and if we suffer, then we have to basically manage it and suffer and then we have to go. But I sometimes question, why do you have to suffer if somebody has said, you know what, please you need to end this stuff. I'm suffering so much. And if you listen to those people and let it go, which I think there's a big debate about the assisted dying and stuff like that. So, but religion plays a big part in some people's lives. They said, no, they have come here and they have to live as long as they can, even if they have to suffer. And that's their choice, I guess. And that's why with my parents and stuff, I did the power of attorney many, many years ago for health and wealth. So if something happens and they're unable to make a decision, I'll make that for them and I have to live with it, I guess, like you said. So, but yeah, but thanks for answering that. Anything else you want to ask me? Yeah, we've known of each other for many, many years. I
Yeah.
only come to see you maybe 3 or 4 times and seen you guys in Waitrose and other places, yeah, in the Sheen, yeah. But But yeah, thanks again for referring some clients to me. And yeah, so I appreciate that as well. And I also mention you guys as well. When
Yeah,
anyone,
we know you do.
yeah, and some of them live far away. I said if you can travel to Shin, then yeah, go and see either of them. That would be fine. Yeah. So what's next for you guys? Next level. Um,
Next level.
mm,
Well, it's summer,
okay.
and we should go down to Chichester and go to the theatre.
Oh, okay. I
And
thought you're gonna say we're gonna go to space now and do some physiotherapy.
and we will have a number of people coming from New Zealand and
Yeah.
around to come and
Okay.
visit us.
Do you still travel to New Zealand, or you?
I haven't been back to New Zealand for
Yeah.
quite a few years.
Do you still have friends and family? I guess.
Yes.
Yeah. Okay. Yeah.
We do.
It's a very long way to go, and I'm scared of flying. So to me, to go that far would be like a nightmare. But I guess I had one client who I don't train anymore. Christchurch. She came from here, Christchurch. That's where they used to go. Yeah. But yeah, I've only heard and seen documentaries. It's a beautiful country, but one day I think I will have to make a move and go there, spend some few weeks there.
You could always do it in shorter hops.
Yeah, I could do that. Someone flew a Cessna 152 to Australia. I think it was 6 weeks he flew. So hopping everywhere. Two-seater plane to Australia from London. 6 weeks.
You got to take a few curves
I know.
around
Yeah.
Ukraine and Iran at the
Yeah,
moment.
yeah, we don't go that way anymore at the moment.
Yeah.
Yeah, they have to go all the way around. Yeah. But yeah, so thanks guys for coming down, and I really appreciate it. How did you find this? It was just a chit chat, and it was very
chit-chat.
yeah,
Yeah.
it's very
Slightly
lighthearted.
easier than I thought. I was
Yeah, everyone says that. Yeah, and you know what? All the podcasts I've done, I've never been nervous. Today I was, because I had two great people in my show, so I was nervous, not you guys. So it's like I felt, oh, how will I do? Because you guys are amazing at what you do. So thanks for coming down, and I hope this was good. And then I'll let you know when it's released as well, and you can let your patients and clients know as well. So it'd be nice. But yeah,
Well, thank you very much
no,
for the opportunity.
you're most welcome. Hope you have a great summer.
Thank
Yeah,
you.
And
and
travels
you
as
too.
well.
What
Yeah,
are you
thank you.
flying?
No, so I'm learning how to fly, but I never travel in summer. I always go in winter. So, and then also because school holiday is quite expensive, so I always go when there's no school
Bang on.
holidays.
If you don't need to.
Yeah, this is it. Yeah, and I like Europe, so I'm going back to Italy, going to Portugal again. So,
We've taken a bit of a penchant for Italy.
have you? Okay.
We haven't. No.
We
Okay.
haven't
We
travelled
haven't done
there
a
a
huge
lot.
amount of traveling because
I've not been to South. I've been a lot of northern Italy, so I'm going to Naples and Sorrento and Pompeii. Which I've never been.
We have
Yeah.
not done that.
Yeah, that's already booked everything, so that's going to happen as well. And then maybe Japan's on my list. Again, it's too far. Yeah, but that might be after a year or two with friends, I guess. So yeah, it's an amazing country. I've been told. A lot of my friends have been there. So, but you can't just go there for like a week. You have to at least go
No.
for 14 days or
Same
so.
with New Zealand.
Yeah, Argentina I went last year, and 9 days were not enough. I was tired. Took me 17 hours to get there. 3 days to recover. And then like I was already tired, and then by the time I was recovered, I had to come back again. So I'll recommend Argentina and Uruguay. Uruguay is amazing as well. So amazing places.
one day we will get there.
Yes,
One day
when you
we'll get
retire,
there.
that's it. Yeah,
Just,
Yeah. Perfect.
we will eventually.
Cool.
thank
Thank
you.
you.
Thank you.
You have a
very
nice evening.
much.
Yep.
Yeah.
And hopefully, well, if I say I'll see you, that means I'm injured. So I'll see you around
Ah.
outside
See you in
here.
Waitrose.
See you.
See you in Sheen.
In Sheen, of course. Yeah. Thanks, guys.
No,
Yeah,
Perfect.
Thank
very
you.
much.
You're most
Thank
welcome.
you